this, and I'm an educational psychologist and educator. I've worked for national associations for quite a long period of time, including the National Association of Elementary School Principals, where I directed research and professional development for a few years. I've had my own company since about 2009, and heart-centered learning is our brand, I guess, for the way we look at social emotional learning. We have a book that has just come out on mindfulness practices, cultivating heart-centered learning, and we're working actually on a couple more that relate to this area, as well as the instrument we're going to be using. So I'm so glad that schools are finally focused on mental health concerns. It's certainly about time. And I'll say I've worked with kids who've been, in the middle schools in gangs. I've worked with schools where, in fact, the schools have served urban poor and have been inundated with issues that kids bring to schools. So again, I'm so pleased that we're finally taking the time to look at this.
Thank you. Let's see, how about Jen Scarpati? If you could introduce.
Hi.
Sorry, I caught you as you were walking. I apologize.
Yeah, I'm gonna move where it's a little quieter. My children are downstairs. All right. Yes, my name is Jen Scarpati. I'm an elementary school principal in Nashua, New Hampshire. I was an elementary school teacher prior to that. And I've been working, really a lot of my career has focused in the field of mental health and the challenges that that many of our young kids face in the trauma that they've experienced. I've looked at models of resiliency and building protective factors, and how as a building level principal we can put a school culture in place, as well as supportive practices and programs that support kids to be resilient no matter what challenges they're facing. And the past few years, we were lucky to have a mental health in schools grant, a federal grant that allowed us to really do a lot of work and professional development in that area at our school. So a lot of work to go, but that's kind of where I've been and what I've been focusing on the past number of years.
Thank you so much. We appreciate that. Let's see, Joelle.
Hi there, I'm Joelle Bruckner. I am from Williamstown, Massachusetts, and I'm a principal, I'm an elementary school principal here. Before that, is my microphone working?
It is.
Okay,
Yes.
So you might hear my puppy bark, sorry about that. Before that, I was a teacher in the same school for 20 years, and prior to that, I have a social work background at both the college level and early intervention, so I came to education with a mental health kind of mindset. And over the past 5 years in particular, we're finding, I don't know if the demographic of our school is changing or just the needs that children are bringing to school are intensifying. And we are in the northwesternmost corner of Massachusetts, where the services are far and few between. We have 8-month waiting lists for therapists for students. And we feel really strongly as a school that we need to be doing more. So I'm doing lots of research and trying to find ways that I can bring both professional development for our teachers as well as supports for students and families into the school any way possible.
Thank you very much. Let's see, Patty Jomo.
Yes. Hi, I am from Greenwich, Connecticut. I do consulting and family engagement in one of our Title I schools here in the Greenwich district. And the principal that I am working with there has a very strong focus on toxic stress. And we were lucky enough to have Dr. Grindell come and show her film, Resilience, and speak to us. And so we've been trying to go down this path with our Title I schools and the school I'm working with in particular. And so I just wanted to have the opportunity to learn more and integrate this facet into family engagement as well.
Great, thank you so much. Let's see, Alice Woods.
Hi, I'm Alice Woods. I am working at the Rhode Island Department of Education, and I coordinate an initiative on social emotional learning, and I'm also involved with behavioral health. So I'm here just kind of to learn about what you're doing and what's happening. We have a lot of schools that are very interested in supports, resources, getting assistance, and helping kids with mental health issues. It's becoming more and more prevalent. And as somebody else said, the needs are getting more and more intense, and schools are looking for help. So I'm here to find out what's going on and if there's a way that I can share information with some of the schools in Rhode Island.
Great, thank you. Let's see, how about Stacia Fowler? Stacia? Is that right, Stacia?
Yeah, I go by Stacy.
Stacy.
I work at the Maine Department of Education, and I work in special services. So my primary job is working with kids who have special education needs, but more specifically, I work with students who are in what we call special purpose private schools. So there's sort of that the next level of students that public schools can't handle, usually for mental health and behavioral issues. So I really am just trying to get some more information to be able to help support both the public schools so that they can keep the kids in their public schools, but also be able to support the special purpose private schools, because I agree with everybody else. I mean, I think our kids are getting more and more damaged, and that makes it harder for the public schools to serve them. I don't know about in other states, but our state, the public schools are trying to keep kids in the school more, which is fabulous. But that means that the kids that are going out of district and going to these special schools are really, really intense. And that's been a real challenge for them to sort of changing their demographic as well.
Okay, great. Let's see. Kini? Is that right?
Hi, yes, Kini.
Kini.
Yeah, thank you. I'm Kini Tinkham. I'm from Maine, and I work for the Maine Resilience Building Network. We're a statewide organization with about 1,000 members. We are spend most of our time working on educating folks about ACEs and resilience. We work in schools, faith-based organizations, community coalitions, really trying to support resilience in communities and in schools. We've been around for about 12 years. I've been a volunteer organization, and this spring we'll be applying to be a 501c3, which is very exciting for sustainability. And a model that I've had the good fortune to work in is a school-based health center, where we did integrate behavioral health and physical health care in a school setting. And in my opinion, it's the best of all worlds. So I speak highly of school-based health centers. Thanks.
Also a fan. Let's see.
Thank you.
Let's see. Joan Cabello?
Hi, I'm Joan Cabello. I'm the principal at St. Albans City School up in Maine. We're in the northwest corner of the state, pretty close to Canada. But we're a city in this rural place. And so we are, it almost seems like the magnet for people who have mental health problems, because that's where the services are, in that rural area. So I've been at my school for 11 years, and I've watched the needs of my children become intense over those 11 years. And so it was about 6 years ago that we started partnering with NFI is what they're called, but it's one of the organizations, the mental health organization in Vermont. And we had a trainer come do trauma training with us, which is what they were calling it then. And we worked with him for 3 years. And now the last 3 years, we've been working with another school psychologist. And she calls it resiliency or compassion training. And we've been doing that. And it doesn't matter how much I learn. It's never enough. I don't feel like I have enough skills, and I want to be able to support my kids and my teachers so that we're able to do the work that we have to do to teach kids. So it's an unbelievable, I don't know, situation that we're facing right now as a country. Our children are hurting, and finding solutions is something I'm hoping to become part of. I'm hoping that this helps me a little bit. I'm also the lead for my district, so I have multiple schools looking to me for some of the stuff we're doing and facilitating that.
Okay, thank you very much. Let's see. I have somebody just listed as iPhone.
That is probably me.
It might be me. I don't know. I'm Stacy Batchelder Giles. Do you want me to go or is somebody else?
Yeah, that's fine. And then we'll do the other iPhone.
Okay. So my name is Stacy, and I am also a principal in Nashua. I actually worked under Jen Scarpati as her assistant principal, which is fabulous. So I'm a fourth-year principal at another elementary school in Nashua. And we're one of the smallest of 12 elementary schools, but what's really unique about our school is that we have 9 district-wide programs. So we have students bussed in from all over the city that attend our school. We have 5 intensive needs early intervention preschools. And then we also have 4 what we call project achievement classrooms. And those are students with emotional and behavioral disabilities. And so a lot of trauma backgrounds, mental health issues, could be severely ADHD, but just in general not coming from a good background of some sort. So, starting with Jen, and I think I was there the first year of the implementation of the mental health in schools grant, and then moving on to this position and just seeing the huge need for not just our students in our programs, but even resources and information and help for even some of our preschoolers that are coming in. Seeing that need. And then again, last year, just being another thing that interests me that has kind of grabbed me into this is attending some of the New Hampshire Principal Network meetings, where we listened to Dr. Yackley was one of our presenters last year, Cassie Yackley, who's does a lot within our state for trauma sensitive schools. And then being a part of a group of women that I just have hooked up with that are starting to plan some of the professional development for those network meetings. And it seems like it all comes back to mental health and social emotional learning, and how can we support each other in that way.
Great, welcome. Let's see, other iPhone.
Can you hear me? Erica McLaughlin?
Yeah.
Okay. So I apologize for my voice. I'm sick also. So I am 14 years in my current school as principal. I, like Joan from Vermont, have seen a significant increase of kiddos living in toxic stress. So we've been engaging in our learning about building resiliency with children also for the past few years. And like Joan, we can't learn it fast enough. And thankfully, I have teachers who are ready for this learning. And we've had half-day trainings this year a number of times, and they have just said, when can we have more? So already next year, I have a psychologist coming around once a month for half days. She'll be doing more training to dig deeper into the resiliency factors and helping to build our capacity to help students. And when this opportunity came about, it was a no-brainer that we should be totally on board and hopefully participating fully, because I've got a school that's ready to go. So prior to that, I was working in inner city Bridgeport, Connecticut. So it's been interesting for me over my 22 years of career, always kind of being in high poverty and at-risk in communities, to see really in rural Vermont, it really is pretty similar to my 15 years ago in Bridgeport, the trauma that kids are experiencing. So I'm hopeful and feeling grateful for this community.
Well, thank you. Welcome. Did I get everybody?
I'm Carol Marcinkus. I'm calling in from Howland, Maine, principal of 2 schools. We started having home-based counselors come in probably about 6 or 7 years ago. Our problem is there's not enough counselors. that, you know, are available. We started after we did a large program with NAMI and brought NAMI in on suicide and opened it up to other agencies and had multiple meetings. And at that time, nobody had thought about bringing the counselors in. I asked if we could possibly get them in. One of the big hurdles was insurance. Who has insurance? What type of insurance will they take? Once we got that hurdle over, we've had counselors in the building at the elementary school, junior high, and high school. And they usually come and they'll take students out of classes for, you know, maybe a half an hour. But we have found it to be extremely beneficial. Our concern is we can't get enough counselors in the rural area.
Yeah, thank you. That is a very common concern. We're hearing a lot in this. So welcome everyone. I know that took a few minutes for everybody to introduce themselves, but I'm really, really grateful to have heard a little bit about all of you and very impressed with the amount of knowledge and experience already within this group. And we hope that you will decide to join us as we continue on this collaborative journey. And so I think it's a really wonderful opportunity for all of you to hear what other of your counterparts throughout this region are thinking about, concerned about, worried about. And as we know, working in schools is tough, and it's always valuable to have some solidarity with people in the trenches. So we will continue with the webinar. Let me get back. Whoops. Just a couple of housekeeping issues. There is a group chat or chat function in Zoom. If you have any sort of questions, please feel free to type to me or to the group. And we will be doing some sort of poll questions, and you will be answering the poll questions within that group chat. You can also raise your hand or obviously break in if we're not seeing you and you need to ask a question. So tonight in this webinar, we want to talk about what this initiative is, this Childhood Trauma Learning Collaborative, and start off with a little bit of background about trauma and school-based mental health, just very briefly, and you all will know much more than this already, but just sort of to set the scene for what we're talking about. And then I want to move from there into an introduction to the CTLC, is what we're calling it. What this project is, the larger project that the CTLC is part of, and how it's funded, and the activities and things that we are hoping to achieve throughout this project. We're going to be talking about a questionnaire analytic tool that we will be using as part of this, introducing you more to our partners within the project and our staff members, the role of the CTLC fellows, which are the positions that you all are interested in becoming part of this collaborative group, and then talking briefly about next steps and contact information if you're interested in continuing with us. So I just got a question. Will the recording of this webinar be shared upon completion? Absolutely. We are going to, I'll do some editing with my team, and then we will post it up on the website for this larger project. So we will be sending out the link if you want to share it with anybody or review it yourselves. Okay. So now I am going to kick it over to Dr. Chris Mason to talk to you a little bit about trauma and trauma-informed schools. Chris.
Hi, I want to say first, if you didn't register formally for this webinar, please make sure and send either Martha or me your email address, and that way we can make sure we follow up with you. And at the end of the presentation, we'll have a slide that has our email address, so you can get it there. So I think you all know a lot about trauma from what I heard, but say things we think about as we work with schools. We know that 1 out of 4 children experience a trauma before the age of 4. And if you're a teacher in a classroom, that's what, a quarter of your class, a fifth of your class, that is traumatized. And that makes a significant difference in terms of what you do as a teacher. We also know that almost 60% of the kids under 18 have experienced at least one traumatic event, including sexual assault, physical or emotional violence, or bullying. We know that over 6 million kids each year are referred for child support services, and that's underreported. And of course, not just because there's a referral doesn't necessarily mean that there's been an incident. However, our numbers are high. They're really high. What are the consequences of this trauma? You know, some of you referred to ACE. We've got the ACE studies, the Adverse Childhood Experience studies that show that adults who have serious health issues have been traumatized as children, and many of them didn't have the protective factors that we're trying to put into schools. We know that trauma can result in cognitive, emotional, and behavioral delays and stressors that can lead to difficulties with learning, blocking learning that happens in the brain, leading to achievement gaps, to adolescents who are more likely to engage in risk-taking behaviors and violence, to risks of dropping out of school or not doing as well as one could, and risks for behavioral health disorders, including mental health concerns. Want to take this one?
Sorry, I was trying to unmute myself. So as Chris said, and as you all know, the consequences of trauma are many, and it can range from increased risk-taking as children become adolescents, and behavioral health disorders, including 2 that we're particularly focusing on for the CTLC, which are early psychosis and teen suicide. So teen suicide is something that is being talked about, fortunately, more and more, and you're hearing more about it in the media, but many people don't realize that suicide is the second leading cause of death for kids ages 10 to 24. And suicidal gestures and ideation are some of the largest reasons that kids end up in emergency rooms and seeking medical attention. One of the other things that we're focusing on is early psychosis. And for those of you who aren't familiar with that term, those are some of the precursors to other kinds of behavioral health disorders like schizophrenia. And psychosis is something that we see developing as kids are reaching later adolescence. And this is one of those behavioral health challenges that people within and beyond the mental health system are really struggling to understand how to recognize and then what to do about that. But one of the things that we know is that trauma-informed, child-centered interventions can improve resilience and learning achievement. And several of you mentioned the idea of compassionate schools, trauma-informed schools, having psychologists in your schools to provide support to your kids. And we know that that makes a really big difference for children as they are growing and hopefully mitigating some of the risks of trauma as they get older. So schools are ideal settings to provide this kind of support, and it sounds like you are all really familiar with that. The kids are with you all a large amount of time, and while many people used to think that schools weren't the place to manage those kinds of health concerns, what we've really found is that the concerns are large enough that we can't help but to manage and address those concerns. And if you're lucky enough to have a school-based health center, even better and even more resources. But we know that even if you don't have a school-based health center, having nurturing, supportive, educated adults in schools is one of the most significant protective factors that kids can have. So Chris, I'm going to hand it back to you for the polls.
So we have a poll here. The way we'll conduct it is, if you will type your answers in the chat box, make sure you put the number as well as the response. We have 3 questions, so here are the first 2. We'll pause, give you a couple minutes to answer, and then go on to the third.
So the first is, are you, your school, district, or agency concerned about either early psychosis or teen suicide, or are neither of these a concern for you or your school, district, or agency? And then the second question is, does your program or school or district offer any prevention or treatment programs in the areas of either early psychosis or teen suicide, or neither? I'll give you a moment, then we'll, let's see. Question number 3, if you're at a school or district, is your school or district trauma informed? Yes, no, or in the process of becoming trauma informed? Okay, I will be tabulating those responses as, oh, actually, I'm going to introduce you to a little bit more about the Childhood Trauma Learning Collaborative. Since it's very clear that you're all on board with the idea that yes, children are traumatized, and yes, they need help and support within schools. So this collaborative is part of a larger initiative that's funded by the Substance Abuse and Mental Health Services Administration, which is a division of the Department of Health and Human Services at the federal level. And SAMHSA has funded these centers, MHTTCs, which stands for Mental Health Technology Transfer Centers, around the country. And they are divided by region. So ours is the Northeast region, or the New England region, of Maine, New Hampshire, Vermont, Massachusetts, Rhode Island, and Connecticut. And these centers are also funded to have a particular focus on school-based mental health support and technical assistance. So because of that funding, Yale, the Program for Recovery and Community Health, which is the lead organization for the larger Mental Health Technology Transfer Center, has partnered with the Center for Educational Improvement in Virginia to create this collaborative to support school-based mental health education. So you will see all of our names as we go through talking about this initiative. The MHTTC, the Yale, what we call PERCH, Program for Recovery and Community Health, and CEI. The aim of the Childhood Trauma Learning Collaborative is to enhance school cultures and prepare school personnel to address trauma and improve the mental health of school-age children in New England. And that is from early childhood education through the end of high school, so from birth to age 18. The CTLC is a year-long project, and our goals are to foster alliances to address the needs of children and youth who have experienced or who are at risk of experiencing significant trauma. Our second goal is to provide publicly available free training and technical assistance to early childhood, elementary, and secondary teachers, principals, school psychologists, and other school staff. And then our third goal is to accelerate adoption and implementation of mental health evidence-based practices through this collaborative for New England. So again, our goals: foster alliances within schools and communities, provide publicly available free training, and then accelerate adoption of evidence-based practices for school-based mental health care. Chris, do you want to talk about the activities?
So with the funding, we have a 1-year project, and the way we've designed this, we want to make sure in some ways it's kind of a grassroots, bottom-up approach, so that we get information about what you're doing already, where your needs are, and what we can do to make things better. I will say that, with my organization, the approach we take, our philosophy, our belief is that the problems are so serious that we can't just do an after-school program, we can't just do a social emotional learning program. We need things that happen day in and day out, year after year for kids. They need to be in compassionate school environments, and we believe we can get there together if, in fact, we do things such as this project. So with this project, we're going to recruit 2 educators from each state, and I know some of you have already gone ahead and applied for the Fellows application. If you haven't and still want to apply, please get in touch with either Martha or me after this webinar. We'll get materials to you. We hope to have those decisions made very soon. The Fellows will each invite 5 schools each, so it'll be 10 schools per state who will participate, and they'll use our instrument, which I'll talk about in just a minute. And you'll also get a chance to participate in the broader network, the mental health network that we're working with this project. Okay, so you've seen the word S-CCATE. That's the School Compassionate Climate Assessment Tool for Educators. This tool we've been developing for the last 5 or 6 years. We started out, would you believe, about 5 years ago with like 80 pages of rubrics for what we thought teachers might want to do if they wanted to establish more compassion in schools. About 2 years ago, we did some pilot work in Pennsylvania, West Virginia, and Massachusetts, and got the instrument down to about 140 questions. And then last year, we did a validation study. And this is kind of where we're ahead of the pack in a way. Our validation study was sent out to educators across the country. We had 890 respondents. We have very high reliability and validity data, Cronbach alpha of 0.95 plus, and we're down to about 40 questions, or we are down to 40 questions right now. The assessment takes 12 to 15 minutes to complete. It's an online tool, and you get data including graphs that are easy to read and recommendations for professional development and interventions. We designed this to be a teacher empowerment tool. So rather than having people come in from the outside and say, this is what you need to know now, we can share the data with teachers, with teacher teams, and make decisions about what we need to do next.
Excuse me, Chris, it looks like we have a hand raised.
Okay.
From, oh, I'm sorry, I forgot your name. iPhone.
Oh, was it me?
Yes.
I'm sorry, back earlier, I couldn't figure out because I'm on my iPhone how to respond to your questions, but we've moved on, so we're good.
Oh, okay, great.
Sorry.
That's okay.
I'm sorry, go ahead, Chris.
Okay. So with this tool, anyway, first our philosophy. Our philosophy says that we believe 5 things are really critical to establishing compassionate schools. These are consciousness or mindfulness, confidence, courage, compassion, and community building. And rather than having a laundry list of social emotional factors, we believe those 5 things are important. Can you go back to the last slide? Okay, so the first one, which is kind of related to this, is leadership and compassionate school communities. We need to have communities that are compassionate, and that involves having principals and other administrators who are on board and encouraging that. Okay. The next 2 factors have to do with students' conscious awareness of emotions and stress. And not only students, but teachers. One of the things that we want to do is reduce the stress of teachers. And from our approach, and this is one of the things that's unique about our instrument, it takes a mindfulness approach, and it also references neuroscience and neuroplasticity. We know from so much data right now that when we take time to help students breathe and be mindful, and when they learn about emotions and stress, we can remove blockages to learning and increase well-being. So that's important. And then courage and resiliency. I heard a couple of you mention resiliency. We totally agree. You know, we need to help kids develop skills so that when something happens, they can bounce back. Confidence and positivity. You know, I started out as a special education teacher, and I can remember thinking about the kids who struggled so much in school. And, you know, they'd have these papers with these red check marks all over the place. And you'd wonder how on earth they could even face reading or math day after day with that happening. And so we still are at a place where we have kids who lack confidence. And we know if we can help them feel successful, that in fact, again, we can work with the brain, the neuroscience, to help them feel better about life and gain some real important life skills as well. The last area is one of the areas that was kind of embedded in our 5 C's. It has to do with equity. And when we think about all the trauma, we think about everything that's going on. You know, I'm in the state of Virginia right now, right? So we know that discrimination is a huge problem. Racism is a huge problem. Poverty. 1 out of 5 kids in public schools is, no, 1 out of 5 kids is living in poverty. 50% of the kids in public schools live in poverty. And yet we're the wealthiest country in the world. There's something very unjust about this. And we know that all kids need to know about this and understand it. So with our tool, what we want you to do is to take the instrument yourself, look at it, we'll talk to you about the results. We will ask your help in finding 5 additional schools to take the instrument, we'll share results, and that'll be used to drive what we do in terms of looking at priorities for interventions, for our webinars, for our resource library. And so, and then we'll use it throughout the year to say, okay, how's your progress going? It's a tool that you can use to help with your ESSA reports as well. Here's a couple sample questions. We've got a scale of 1 to 4. It's a teacher or participant Likert scale where it's a self-rating device. On a scale of 1 to 4, 1 being needs improvement and 4 being exemplary. When we worked with schools in the past, we've said, you know, don't aim for proficiency, aim for exemplary. That's what we want. We want schools that really shine in these areas. So empathy is important, and we know that that sense of belonging and connectedness is very important as well.
So we just want to tell you, now that you have a sense of the kinds of activities that the collaborative might do throughout the year, we just want to tell you briefly a little bit more about who we are and some of the resources that we have for this collaborative. I introduced myself earlier and mentioned the Yale Program for Recovery and Community Health. We are located in the Department of Psychiatry at the Yale School of Medicine here in New Haven, Connecticut. And the goal of PERCH has been for the last 20 years to transform the behavioral health system at large, from programs to agencies and larger systems, to be culturally responsive, trauma-informed, and reoriented to facilitating recovery and social inclusion for people with lived experience of behavioral health disorders and their families and communities.
At CEI, we have 4 areas of focus. 2 of them are particularly relevant to our work today. So the heart-centered learning, that's the 5 C's of compassion, courage, confidence, consciousness, and community, we believe are critical. And then looking at the neuroscience research to accelerate learning and also a sense of well-being.
And as I mentioned before, this initiative is part of the larger Mental Health Technology Transfer Center for the Northeast region, which is a partnership between Yale, the Harvard Department of Psychiatry, and the Center for Social Innovation outside of Boston, and really brings a lot of infrastructure and resources to bear in terms of the behavioral health side of this initiative from the departments of psychiatry from both Yale and Harvard, and some of the social and emotional factors and social justice aspects of this initiative. And those leads are Dr. Larry Davidson and Dr. Maria O'Connell, who's our evaluator, and Maria Restrepo-Toro, who is our at-large project manager. Our CTLC leads are myself and Dr. Mason.
And then on my side of the team, we have Dr. Michelle Rivers-Murphy and Jill Flanders, who are in Massachusetts, and our faculty that will be working with the project, Suma Lane, who's done work in West Virginia, particularly in the early childhood area, and particularly focused on families where opiate addiction is an issue. And then Dr. Hillary Hodgson is a researcher who I do work with out of the Trauma Center at the Justice Resource Institute in Boston. And then we have a support team, Ingrid Padgett. If you work with us, you'll see her name a lot. She's really helping to make sure we have materials to you and a good flow of communications. Orinthia Harris, who normally would be helping with this webinar, she had another commitment tonight, so we are proceeding. And then Dana Asby, who is an intern with CEI.
Chris?
So we're going to go pretty quickly here. So we offer diverse subject matter expertise, training, and technical assistance. And Martha, did you want to say more about that?
Some of that we will be developing with our fellows in this fellowship, and some of that will come from the larger MHTTC project. But we will, as Chris mentioned in the activities, be having webinars at least monthly. You'll have access to all of the resources from the larger center and the national centers. And we will also be developing a repository, a resource center for all different kinds of resources related to this topic, from curricular programs that you'll have access to use freely, or articles and sort of state of the science in terms of education or behavioral health to support your work, as well as more individualized consultation on whatever subjects are of interest to you in your local area.
So because of the affiliation with MHTTC, we have access to a huge network of resources, not only in New England, but nationally. And we're going to try to do our best to help organize those and get those to you and to your states in a way that is most useful to you. Okay, so the role of the fellows. So some of you have filled out the applications, so you've probably seen this before, but let's just go through quickly. We want to make sure that schools have effective social emotional learning practices, that we're making sure that schools are embedding practices that will improve school climate, student health and well-being, and that the activities are most relevant to you, to your cultures, to the experiences of the stakeholders. What do we expect? We believe it's going to take about 5 to 6 hours a month for each fellow. That will probably include like 1 hour a month in a webinar, and the other 4 hours doing networking, maybe sometimes behind the scenes planning with us, so that you can help us develop a strategic plan, a communications plan, a plan for what we do after 2019 even in these states. We would like your help recruiting schools, and that actually process will begin soon. So we hope to have an announcement regarding fellows within the next week. And then right away, one of the first activities is to try to bring other schools on board. We have a school application form that's available. And basically, the expectation is that schools will complete S-CCATE and let us know then what their interests are in terms of professional development and where they have technical assistance needs. So we'll be able to provide some technical assistance support. We will have some online support available, and we will also help search for other resources to help schools out. So basically, there's 2 fellows per state. We're looking right now at a possible kickoff meeting in Boston on April 8th. Everything else is pretty much at the state level. If any of you happen to be really interested and maybe have your own resources, because we're a little resource shy in this area, there is a meeting down in Baltimore next month, March 14th and 15th. And it's a national meeting that will look at the school supplements for this project nationally. So we're real eager to go there and become engaged with the rest of the country. And if you get interested, let us know.
Hosted by the University of Maryland Center for School-Based Mental Health Education. So they have a lot of resources and expertise. If that's something that you are interested in, please let Chris or me know. Chris?
Okay, so we've talked about the webinars. We've talked about the general concepts we're working on. Purchase resources that will be available to you. There is also a stipend of $1,200 and the opportunity for CEUs as well. And again, you know, your help recruiting schools, getting things out, the networking communications really is our most critical area. The first round of applications for schools, getting the schools on board, is March 15th. So now we have time. We're running over just a little, but if you have any questions, we're happy to answer them. Otherwise, we'll just go to next steps.
Let's see, Chris, I have one question. What do the schools have to do when they're recruiting schools? What is it that they're asking the schools to do?
Again, we have an application that they will fill out, and it's basically they will agree that their teachers will take the S-CCATE. We will use that data to provide feedback to them, and we will be able to compare the data for the individual school to our larger sample of schools so they can see how they stand up in regard to other schools. We will identify their strengths and needs, and then what schools do beyond that, given that we're doing this part of it kind of on a shoestring, is really going to be determined by the school's interests, the availability of resources they might have, or other resources within the New England area. So we might give recommendations and think towards the future with them.
And we have another question, Chris, which is where can they find the applications for the fellows and the schools?
The best thing right now is we're still getting some of this posted. At my website, I think within the next week, we will have links to these. However, contact Martha or me, and we can get one to you right away.
Do we have any other questions? I know that we covered a lot of information fairly quickly, but just wanted to give you a sense of what we will be working on for this initiative. Okay, if you're still thinking of questions, I will just let you know that from the polling questions, out of 10 people, it looked like people had initiatives in their schools that were focused on suicide prevention or teen suicide most often. One of you had initiative on early psychosis, and that most of you are not in trauma-informed schools, but some of you are working towards that. There are a couple of you who are already in trauma-informed schools, which is great. Any other questions that you thought of? Okay. In that case, here is some contact info. If you are interested in getting an application, My email address is not on this, but if you want to get in touch with me, or if you have questions about the larger MHTTC work, or about my program at Yale, if you want to send an email to Christine Mason, she will get that forwarded to me.
Right.
Okay, so I just want to say again, thank you so much to all of you for taking the time this afternoon, this evening, to talk about this important initiative. We're really excited about the work that we are beginning to do. As you all so eloquently discussed, this is such an important topic, and so many schools and teachers and school personnel are really struggling with how to support their students and to support each other in this important work. So we are very excited about this initiative, and we hope that you will consider joining us. So,
And I'll just say the same thing. We encourage you to get your applications in if they're not submitted, and we will get back to you shortly. And we look forward to working with the fellows and with New England during the year to come.